In this lecture, we are going to discuss urinary tract infection, or you can say UTI. We will cover the all aspects of the urinary tract infection. So without wasting time, let's get started. First of all, we will see the four most important components of the urinary system. First one is the urethra, second is the urinary bladder, third is the ureter, and fourth one is the kidney. So these four components makes urinary tract. So infections of the urinary tract is called urinary tract infection or UTI. If the infection is in the urethra, then it will be called the urethritis. If it is present in the urinary, then it will be called the cystitis. If it is present in the kidney, then it is called pyelonephritis. Infection in the ureter is uncommon, while the infection in the urethra, urinary bladder, and the kidney is common. So, what will be the cause of the infections? You will see the lot of different gram positive and the gram negative bacteria involved in causing the UTI. So, we have categorized the UTI on the basis of the associated conditions. If the person is healthy, normal, and there is no structural change happening in the urinary system, then it will be the uncomplicated UTI. But if UTI is associated with different conditions like diabetic patient, in the diabetic patient, in the pregnancy, in catheterized patient, and in the stone obstruction case, you will see in that case UTI is called complicated, and it is difficult to treat UTI in that associated conditions. So that's why we have categorized uncomplicated and the complicated UTI. Second, we have also categorized UTI on the basis of the symptoms, whether the symptoms are appearing or not. So we have categorized symptomatic UTI and asymptomatic UTI. Symptomatic UTI, you will see clear symptoms of the UTI. We will see later. And in asymptomatic UTI, you will see bacteria present in the urine. Urine routine examination, you will see bacteria in the urine, but you will never see any symptoms in that case. So that's why we called it asymptomatic UTI. Now we will see what will be the different bacteria causing UTI. So gram negative and the gram positive bacteria. In the gram negative, you will see Escherichia coli, E. coli, Klebsiella pneumoniae, Proteus mirabilis, Pseudomonas aeruginosa, and the Enterobacter. So these are the different bacteria, gram-negative bacteria that cause the UTI. In the gram-positive one, you will see the Enterococcus faecalis, Staphylococcus saprophyticus. So these are the different gram-positive and the gram-negative bacteria. And you will also see in case of fungus, you will see the Candida albicans. So these are the different microorganisms that cause the UTI, urinary tract infections. Now we will see risk factor, what different condition increases the risk of the UTI in people. First one is the female. Why? Due to the anatomy of the female, because urethra of the female is small, because bacteria move in ascending order, like it will first enter into the urethra, then into the urinary bladder, then into the ureter, and then it can go towards the kidney. So due to the anatomy and the close proximity of the urethra, female urethra, so chances of the UTI is high in the female as compared to the male, because male has penis. So bacteria find difficulty in entering through the penis. Next is the pregnancy. You will see in case of immunocompromised. So in pregnancy, UTI is also increased. Urinary catheterized patient, you will also see, because in that case bacteria get a chance to enter into the urinary tract. Poor hygiene, that is another important risk factor. after the sex, and diabetic patients, renal stone, patient who have renal stone, so that can also be the condition that can cause the UTI, and immunosuppression patient who are actually immunocompromised can also be affected by the UTI. Next, we will see the symptoms. So we have actually categorized UTI on the basis of the parts. So lower will be the urethra and the urinary bladder, and the upper part will be the ureter and the kidney. So in the lower UTI, specifically cystitis in the urinary bladder, so you will see first one is the dysuria, difficult or pain and burning sensation during urination, increased frequency of the urinations and urgency of urination, suprapubic pain, cloudy urine, and the foul smelling urine. So these are the different symptoms that you can see in the lower UTI or specifically related to the cystitis. In the upper UTI, in case of pyelonephritis, when the kidneys are affected by bacteria, you will see the high fever. You can also see the chills and the rigors. In that case, you will see patient feel cold along with the shivering. Along with that, with the passage of the time, the patient body temperature start rising in that case. Flank pain, that is specifically in the lumbar region pain, and nausea and the vomiting can also be seen in that case. So these are the different symptoms related to the UTI. Lab diagnosis, so patient will give the samples of the urine to the lab for further evaluation or urine routine examination. So midstream and clean catch urine will be preferable, and the early morning urine will be the preferable for the laboratory diagnosis. And you can also go towards urine can be streak on the culture plates on the colored agar, blood agar, and the McConkey agar to see the growth of the different bacteria. Next, in the treatment plan, you can also see the most common drugs that is used in the treatment of the UTI: nitrofurantoin, trimethoprim, sulfamethoxazole. You can also see the ciprofloxacin, amoxicillin, and the clavulanic acid, and the cephalosporin. So these are the different common drugs that are used in the treatment of the UTI. If you still have any question, you may ask in the comment section. Thank you so much.